Again, hi, this is Dr. Bhupesh once again from Dr. BKM Institute. Just gonna update you about how to do reading part A today. That is the only thing we would do today. So please subscribe this channel and also follow this video. Never start your reading part A from question number 8. Please. Why? I will tell you the reason, but first let's focus. Suppose, first of all, read first 7 questions. Procedures for delivering pain relief, procedures to follow when splinting a fractured limb. So I'm noticing my keywords. So my keywords, if I can notice in the first is like delivering pain relief, then procedure to follow when splinting a fractured limb. Then the third question is what to record when assessing a patient's, okay, and the term used to describe different types of fractures, the practitioners who administer analgesia, what to look for when checking an injury, how fractures can be caused. So obviously I can't remember all the things in the final exam, but now I know the topic is pain relief, fractured limb, assessing a patient, different types of fractures, so topic is related to fractures. Then practitioners who administer analgesia, what to look for when checking an injury. So I have almost taken the estimate of what my reading has come today. So now I would go to the paragraph. So when I go to the paragraph, reading part A, sorry, text A is talking about something fracture. Then they are talking about direct or indirect injury. That can be the causes. Seventh question was about caused. So it can be one of the things. But again, I don't remember the question. So I would go. Clinically, fractures are either closed and compound, that is the classification. Dislocation is where a bone. So they are talking about type of fracture. At least one question I can do. Sprain. Then they are in the second part. They are talking about management. Simple fracture of limbs. Immediate management. Then there is a word clinical assessment. You don't have to do everything, but medication therapy, joint function, check this and this. Then management part is given, elevate the limb, administer analgesia. One of the question was analgesia. Now this is, so I can do ABCD. Suppose if I want to do these questions, now again I will not break the flow. That is how you will go in the exam. Then drug therapy protocol. Then they're talking about morphine, ampule, route of administration, IV, IM, nurse practitioner. So maybe this answer, who will administer? Authorized engineers, this isolated may proceed. That means they can administer. This can be the answer of that. Technique for the plaster blackstrap for the arm fractures. So that might be the procedure, and fractured arm word was given in two second number question. So now plaster, this all these words are given. And now I will go back to my questions. In the final exam, this is what I'm doing. So procedures for delivering pain relief, I think that should be either in C or B. Again, C, please try and understand. Procedure for delivering pain relief. I think IV, these are the procedure means route. So C should be the answer, IM, IV, according to me. Otherwise, maximum it can be in the management part. If in the management part procedure provide pain relief, but procedure is not given, obtain this and this and this. So in this pain relief is given, but procedure is not given. So my answer first should be C. It will take hardly a second. One question done. Then you will go to the next question. Okay. Next question. The piece. Sorry. This is the one. Sorry. Huh. The procedure to follow when splinting a fractured limb. D. Without checking too much. This can be the procedure of splinting a fractured limb. Still, I will check it. This is also given, but in this procedure was not given. Check whether the limb is out of shape. I think not given. Splint the fracture, elevate the limb, administer analgesia, consider compartment syndrome. It can be one of the answers. Otherwise, limb word I am covering with arm. That is why I am giving importance to D rather than B. So now in the final exam, I don't have time. Time is the thing I want to save. So I will put it D, but I will put a dot over it that I have to revise if I get time. So the main thing about reading part A is to save time. Don't overlook. Means now I can do this answer by watching it again. But it's wasting time. So I just put a dot and I do it D because fractured arm is equal to fractured limb as per me. Okay, sorry. Sorry, that was the other one. Sorry. Means the wrong page has been taken. Yeah. So I will put this. Just this much. Okay, and in the B option, perhaps I couldn't see any that. What to record when assessing a patient? So assessment word was given in the B. So when assessing a patient, so clinical assessment, this is the word. Again, I'm not getting deeper into the paragraph. I'm just doing what is required. Then term used to describe different types of fractures. It should be in the A, easiest question. Practitioners who should administrate C, first line, that is what we did. Practitioners who should. Again, I might be confused. But in this, if you notice, that is what I tell you the importance of grammar. Nurse practitioner or medical officer, that means two. And now please look at this grammar. Even in the question they are saying practitioners, so that means there can be two people. Means if two options are given, then practitioner's word is fitting in. So that is at the background, that is giving me more satisfaction that I am not wrong. So I will do C. Who to look for when checking an injury? What to look for when checking an injury? I think it should be in the assessment part, that what to check while injury. It should be in the assessment part, or maybe here. But again, I will do it B without wasting time. How fractures can be caused? So causes, I think, was given in the start. Indirect or direct injury, that is the cause. So I have done this question. Now I will take your suggestion, and this is how you start the reading. Now, when I told you, you need to start from the question number 1. Why? Now read the question number 8. I will take your help, guys. Please take care of your mics. If anybody has background noise, then please don't answer. But if you want to be with me, okay. Question number 8. What should be used to elevate a patient fractured leg? Where should it be? What should be used to elevate a patient leg? It can be
D, sir.
either
In passage B, sir.
in the B or maximum in the D. Maximum in the D. But when we were doing that part, we could see that limb, lifting the limb, elevate the limb. What should be used? A sling should be used. Again, why this question has become easy? Because I estimate it can be in B or D. So it saves my time. So even if I take 5 to 10, if I save 5 to 10 seconds, then in total 20 questions, I am saving around 20 into 20, 20 into 10 seconds, 200 seconds. 200 second means 3 minutes. I have got 3 minutes extra as compared to normal person who has not studied from Dr. BKM. So that is where the difference is created. What is the maximum dose of morphine per kilo of the patient weight? Okay. IMIV. IMIV word was given in which paragraph,
C.
guys? C paragraph.
C paragraph, sir.
Without name. Today you have not done this reading, but see, that is what mine does. Which part of a limb may need extra padding? In which paragraph it can be? Maximum in
D. D.
otherwise D. Maximum in B, otherwise D. What should be used to treat a patient who suffers from respiratory depression? Where can it be? In the management part.
Paragraph.
It can be in the
C
management part,
paragraph, sir.
in the B part, or maximum in the C, because that's where two managements were given. So respiratory, if respiratory word is given over here, then I will do this. If
Last.
sorry,
Last line, sir.
last line.
Last line.
Respiratory depression. But again, it's hard to find. Naloxone is hard to find. But when you know it is either in B or C, it makes your work easy. Then going to the, so that is what we are doing in all the questions. It's not only for 1 to 7 questions. So you are doing it in all the questions. How to save time? Every 10 seconds saved per question, 3 minutes, more than 3 minutes saved. So or normal human being is doing reading in 17 minutes. We are doing in 14 minutes in final exam. What to do with the extra minute? I will check question number second again. I want to get 20 out of 20. That is the target. Again, target to obviously is 20 out of, but anyhow, more than 18, that's what I am expecting, or 18 minimum. What analgesic should be given to the patient who is allergic to morphine? Which paragraph? Over here, it can be because
B
they
paragraph.
about the morphine. Then, if you are allergic to morphine, then you would give an alternative. So, what is the alternative if morphine does not work? I
Sir,
cannot
B paragraph.
be better. Okay, okay, it's not given over here. So, maybe in the immediate management? No, even I can't see
Sir,
in
management. Administration anesthesia.
allergies. Yeah. If allergic to morphine, then this question was not according to my expectation, but still, it's not difficult now because now I know the technique that first I have to find where it is and then I will read the question. Which condition might a patient have severe pain, persist, splinting, elevation, and repeated analgesia? So, where can it be? In this only elevation splinting, that is what it is given. So it should be around here only,
Yes, sir.
right? It should be over
The
here.
last
Yeah, again,
one. Sir.
the first thing is to learn where it is. Then think well. What condition? Now, if I have to write condition means consider compartment syndrome. That should be the answer. That is the first. Where is the location? Then you find the condition. Mean you need to have a disease. Only one disease condition is given compartment syndrome. So your reading becomes like. But if you get stuck even an extra minute in question number two, man, you are in severe trouble. If you get stuck in question number six, what to look at when checking an injury, man, you are in trouble. Otherwise, what to look should be given. Injury word is given over here. I think it should be in the A, but again, if I do A, it can be wrong. What should we look for is given in A. I think not given in A, but otherwise injury word is given in A itself. Sixth question, where should it be? Yeah, so I will do A because I cannot find the injury word in the D part or any other thing. So I will do A. If doubt over an injury, treat as a fracture. So it can be B as well. Only at 2 points injury word is given. It often results from the injuries, outstretched hands. This is even after giving it time in the last, still it's a tough question. So if I waste time in the start, that is what maximum people have problem. They waste the time in the start and then they say, "Oh, sir, reading part A, I can't manage time." Nobody can manage time if you're stuck at question number six. Even in the last, I don't know whether I will do A or B, but at least I will do other 19 question correct or 18 questions correct because I know the only fundamental to reading part A or C is please don't use extra time. Any question that is asking you now in the reading part A and listening part A, I told you articles and prepositions are important. See a word falling of an outstretched arm. I just saw a word outstretched. Now I want to know only the word A. A bone is completely displaced. So falling on is typically cause of a dash of the elbow, a dislocation of the elbow, right? Then upper limb fracture should be elevated by the means of a elevation word was given at two places in the management. Elevation word would be given in the management either over here, elevate a a pillow for leg injuries. What was the question again? Upper limb fracture should be elevated. So they are asking upper means arm, a word, a sling. See, that is correlation. So I'm just looking at word a. So sometimes articles can be very handy. And prepositions, obviously, like make sure that patient is not wearing any dash on the part of the body. Now I want only word plaster. I've seen the word plaster in either B or D because management was given in B or D. So plaster would be given in B or D. So plaster back slab. So if I go to this plaster back slab, I cannot see anywhere plaster back slab. Then I go to D. Then I say a plaster back slab. I can't see over here as well. Slab. Slab word I can see. So plaster back slab is given over here. Now any word is given. If wrap grab bandage firmly around this. So any word is not given by chance, but make sure that patient is not wearing any dash. Nah, it's not given
Fifth
over.
point, sir. D.
Sorry?
Fifth point, sir.
Sir, D. That fifth
Any.
point.
And see any word is given. Now I can see any jewelry. So please try to understand listening part A and reading part A has to go for the words prior to the blank and after to the blank because preposition and words like this articles are there to help you. Then if I go for this off, now this is preposition. In the plaster black step, there is a layer of dash closest to skin. So in the plastic black step, layer of dash of word is given somewhere layer of layers. So fold the roll in about 10 layers. Make a shear of Paris 1 centimeter shorter than the padding skirt full length. wrapping cotton full length of the stockinette. So I'm now of plaster of Paris or stockinette should be the answer. So otherwise layer of stockinette is two layers. So I think it should go with stockinette. But I have this word off to help me. That is what it is all about. Patient age dash and over should not be given the higher doses of pain relief. Now pain relief word can be given in the C because they were saying morphine. So it should be around morphine and I have adults only. Now I will read the first, try to find the place where it is. So I want to know about the age. Anywhere age word is given. Age word is given guys over here. Na?
Yes, sir.
Paragraph C,
Last
sir.
one.
Oh, 70 years. So more than 70 years. But there is a special thing about this blank. People aged 69. Nah, people aged 70 and over. Because this sign is for equal to and more than. That means people aged 70 and over. Over means more. So 70 years is it's so easy, yaar, when you do OET reading again. Just follow the basics, enjoy the reading, and nothing better than that. This is Dr. Bhupesh again telling you OET is nothing, it's just about this mindset. Again, it's in the reading party when people waste time on a particular question, it goes out of hand and they panic, and then everything goes bad from there onwards. Reading part A goes bad, reading part B goes bad. Even in the reading part B, again, out of the 6 questions of the part B, only 4 questions would be moderately easy. So in the reading part B, finish the reading part B in less than 10 minutes. Save 35 minutes for the part C and do only 4 to 5 questions. Don't try to do all the 6 questions, because when you think that I will do all the 6 questions of the reading part B, then you take around 15 minutes in the reading part B. And then you have only 30 minutes to do part C. Now you are in trouble because 6 questions you have done in 15 minutes and 8 plus 8 questions 16 question you will do in 30 minutes. How is it possible? That is where people lose the track. Again, the fundamental of reading, whether part A, B or C, do only easy questions first. This is your own Dr. Bhupesh again telling you how to go about your reading part A. Thank you very much. Subscribe our channel and please follow us. OIT will become a cherry cake walk. Thank you very much.